Is it preventable? And what can you do if you have this condition to enhance your livelihood? Please welcome back to our program, Dr. Eduji Akudogbe of the Ghana Thoracic Society. Good morning, Eduji.
Good morning.
Interesting. Your name means what? Victory, right?
Victory, yes.
Eduji Akudogbe.
Yes.
Well, my producer says he likes the Aku. I guess it sounds a little special.
Yeah.
What's asthma?
Okay, so asthma, simply put, is a long-term condition that affects the respiratory system of the body. That is asthma. And it's also associated with symptoms of dry cough, wheezing, chest
When you
tightness.
say long-term, what does that mean?
Long-term to mean is a chronic condition. It's long-term.
But does it accumulate over time?
Well, it gets better. It could get better or get worse over time, depending on the treatment and what you have put on.
Oh, wow. Yes. It will get better or worse over time.
Yes.
It means if someone has asthma today, in 10 years, it might be worse.
Exactly.
And in 10 years, it might be better.
Yes, depending on certain factors.
Does that come with people? Does that mean that everybody who's breathing a little heavily and we're hearing certain, sounds from his chest area has asthma? Okay,
so there is a particular sound that is peculiar to asthma. That is what we call wheezing. Wheezing, yes.
Okay.
So wheezing is as a result of narrowing of the airways in which air passes in and out. So the airways is narrowed. There is swelling in the airways. There is mucus plug formation. When that happens, it's difficult for air to come out. So it's like you take a pen. A pen is like a tube. If the pen tube is like narrowed, air passing through that tube would produce a sound like a whistling sound. So that's what we call wheezing.
Let's say you take a piece of paper and you roll it tight.
Exactly.
And you fit it into a pen. It will be difficult for the air to go through that pipe.
Because it's narrowed.
That's what asthma looks like inside.
Yes.
What causes this blocking of these pipes, if I may ask?
Okay, so it's more of an inflammatory reaction that has occurred. So we have certain factors, like triggering factors that causes the inflammation reaction to take place. So your immune system tends to produce what we call inflammatory mediators. These tend to cause the narrowing of the airways, the swelling of the airways, and also the mucus plug formation, resulting to the signs and symptoms that the patient presents with.
You mentioned mucus plug. What formation?
Like phlegms.
That's phlegms.
Yes.
Does that mean that if phlegms hold on your chest for a long time, you might be susceptible to to asthma?
Yeah.
It doesn't mean that.
Mean such. Yes.
Okay, but people who have asthma have their chests normally clogged.
Yes. So the presentation of asthma has to do with dry cough.
Okay.
Yes. Let's taking a good look at it. The airway has been narrowed, and then the mucus plug has formed. So it's going to be difficult for you to even expel the phlegms or mucus that has been produced. So the dry cough is actually non-productive.
Okay. Is asthma chronic?
Yes, asthma is chronic. As I said earlier on, it's a long-term condition that happens. So
possibly stays with you all your life, maybe, if you have
it stays with you all your life.
Is it hereditary then?
Yes, asthma is hereditary. There has been research that shows that if you have a family history of asthma, mostly maternally inherited, there is a probability of you developing asthma.
Wow, that's interesting. You can get asthma just like you acquire property from your parents.
Yes.
Ah, that's sad. So, what's the beginning? Maybe for someone, let me first ask, what age does asthma begin in a human? Okay,
so it affects children, it affects adults.
So it could begin when you're really young?
Yes, when you're at 5 years growing up.
Okay.
Yes, and any adult. Asthma can affect anything.
It could affect you later also?
Later in life.
It doesn't always have to start very early?
Yes.
Okay, so for someone who has lived almost, a good 20, 25 to 30 years, he hasn't seen any symptoms yet, what are the signs to start to see